We're delighted to have Narda Skov and Lisa Unti here. I'm going to let you all introduce yourselves and go ahead and get started.
Okay, great. Welcome, everybody. My name is Lisa Unti. My pronouns are she, her, and we're excited to have you join this topical training workshop. I'm with ETR, and I'm also part of the RTI training and technical assistance team. And I'll be joined by one of my colleagues and co-facilitators today with a lot of support from a lot of other RTI colleagues as well. So I'll turn it over to Narda, and then we'll get going.
Terrific. So hello, everyone. My name is Narda Skov, and I am also with ETR, and my pronouns are she and her. So before we get started, let's go ahead and dig into some housekeeping items. So for logistical purposes, you are currently all muted. If you're having trouble hearing, check your computer audio volume and go ahead and enable the speaker. If you are comfortable, we'd love you to share your video. For our engagement today, we will be using a number of tools. The first one is the annotation tool, and I'll walk you through that in just a few slides. We will be also using breakout rooms. And in those breakout rooms, you will be using a Padlet, and we'll explain more about that in a minute. And then we have icons, which we encourage you to use. If you love something, go ahead and give us a little clap, or if you'd like to share something, go ahead and raise your hand. And as always, we will be engaging with you in the chat. We are also going to use a note catcher, which I'm going to go ahead and drop the link into the chat box now. So if you'd like to use that for just to capture some notes while you're in your breakout rooms, that is a tool for your toolbox. To ensure that we hear and appreciate everybody's perspectives today and all of your insight, as always, we want to take a moment to establish some agreements. We've listed a few agreements on the slide, so go ahead and take a moment to absorb those. And if you'd like to add another agreement, please go ahead and share that in the chat right now. All right, we're all in agreement. I'll go ahead and move on. I don't see anything in the chat currently. So our objectives for today are that we hope that folks will be able to identify at least 3 strategies for creating and sustaining key partnerships during the COVID-19 pandemic and as we shelter in place. We also hope that you'll be able to share at least 3 experiences and ideas with other grantees on how you are engaging creatively with individuals and agency level partners. This might also include reimagining and adapting to different partnerships. So today, we're going to look at how we can frame and discuss types of partnerships. And for the purposes of this training, we're going to focus on just 3 types of partnerships. And we acknowledge that this is not all of the types of partnerships that you experience, but we're going to share some tips and strategies for consideration. Then we'll have an opportunity in our breakout rooms to brainstorm with peers, and then we're going to finish up with a question and answer period at the end. All right, so our first engagement, so to get a feel for how folks are doing today, we would like to do a short exercise to get a sense of how you are all doing. So as you see on the screen, there are 3 boxes with images in each. So using the annotation tool at the top of your screen, go ahead and click on your annotation tool. There should be a little pencil up there. Go ahead and click on that and click on a stamp annotation and mark which box or mood resonates most with you today. If you're phoning in, you can verbally share, or you can also put a quick note in the chat if that's available to you. So if anyone is having difficulty finding the annotation tool, I see some stars already populating. All right, I see some checks. I see some hearts. Wow. I see a lot of people are feeling like it's challenging to engage partners. I hear you. And I see a lot of people have found a lot of creative ways to engage in partnerships. And interesting, folks are saying no one has said that their approach hasn't changed. Of course, as we all shelter in place, this has been a new road for all of us to travel down. Wonderful. All right, I see a few more folks. If anybody's having trouble, this is definitely a tool for your toolbox, again, to be able to use that annotation tool. And thank you all for sharing. All right, well, hopefully as we go into the breakout rooms, we're going to be discussing these challenges, and we're going to be discussing these creative ways to engage partners. So thank you all for sharing those. It's good to get to take the temperature of the room. All right, I'm going to go ahead and turn it over to Lisa to talk about partners and expectations.
Great. Thanks, Narda, and welcome everybody. So we're just going to start with a little bit of getting all of us on the same page just for today's session, and talk about some considerations for setting expectations with our partners. And lots of great ideas that are coming out of this training so far. So let's start with just framing and a starting place to consider the following. It's important to, when we think about our partnerships, and we're going to dive into each of the different partnerships, but just imagine and consider starting with a place of positivity and resilience. It's important to ground ourselves and frame ourselves in realistic expectations for this moment in time. And I really would like to drive that point forward, at least for today's session. Just think about where we are in this moment in time. And this moment in time maybe is not just today, it's been many, many months, but it is a moment in time. So as we consider reimagining and adapting, just keep it in that context. So we want to start with a place of positivity and resilience. We want to think about framing or reframing fidelity. That's coming up quite a bit in our conversations. We know that everybody's at a different place along the implementation spectrum or continuum, and that's okay. We're all at different places for a reason, and that's okay. If we think about framing our work as meeting people where they're at, where our youth at, where you are as your agency, with your agency partners, with maybe new partners that you're considering. But again, meeting people where they're at in this moment in time. And so hopefully that will help us to be sort of engaging or reimagining partnerships then sort of with that proactive thinking and planning kind of mindset. And as always, we want to document, because there's so many amazing, innovative work being done. We want to learn from that. There's lots of lessons learned here that you might want to carry on, or we might all as a field want to carry on, even as we come out of this moment in time. So just remind yourselves that you're doing a lot, and that you're doing things the best you can, and we might have to adjust our expectations as we do our work. And you're all experts, and we really appreciate everything that you are doing. Okay, next slide. So as we said earlier, we're going to talk about 3 different types of partnerships, and really just for the purposes of sort of these big buckets. These are not meant to be all of the types of partnerships, but it's just a starting point for us to engage in our conversations today and to facilitate the dialogue and discussion. So I'm going to briefly just talk a little bit about school community partnerships, health and referral partnerships and linkages to care, and then internal team partnerships that also might include your partnerships with some of your sub-awardees or your sub-grantees. And so imagine, if you could just put your thinking cap on now, we want to reimagine and leverage these partnerships sort of during COVID and start to think about after COVID. And maybe we start moving from surviving to thriving, but it could be baby steps. Remember, it's okay, no matter where you are, we're all at different places, and it's not a race to the finish line. It's not a contest. Okay, next slide. So let's talk just a little bit about school and community partnerships. And as we start to reimagine or think about these partnerships or leverage these existing partnerships, we're all thinking about the larger context, right? And the local conditions that are happening in each of our areas. So starting to even think about, relooking or revising our memorandum of agreements or other agreements that we have with our teachers, our school districts, or whatever implementation setting we might be in. If it's an out-of-home care facility, if it's a juvenile justice facility, but just start to think about the larger context. What is going on in your community? What's going on in that setting? And what are the changing needs, right? What are the changing needs and capacities that are going on with each of your existing partnerships? Starting to work together, if you're not already establishing regular check-ins, because there's lots of other things going on in the school districts and other areas, but think about ways that you can either tap into an existing meeting that might be happening, not creating a new meeting. We're all pretty zoomed out, right? But leveraging where we can and tapping into any of those existing meetings and discussions that are happening with our current partners. And so all of you are already thinking about and reimagining your virtual implementation if you're able to be there. Some of you are still at the very beginning and you're not doing any virtual implementation based on what's going on in your local community and the community needs. And that's okay. That's the starting place. That's where you're at right now. And it's important to just remember, you meet everybody where they're at, which is what you're already doing. I'm just reminding all of you to give yourselves a pat on the back because you're doing a lot. So starting to think about being creative with our adaptations. I've heard from many of you, or we've heard from many of you across office hour check-ins and in some of the sessions prior to this one through the topical training. There's so much creativity going on, but some of you are still struggling with whatever you're given, right, from the school or the community organization with respect to time. Our time is not what we used to have. And so how are we imagining, or how can we reimagine and leverage what we used to do for our implementation, and now what can we do? So thinking about how do you adjust and adapt your program based on what's happening on the ground? What are the priorities? What are the low-hanging fruit priorities maybe in your community that you can tap into and maybe leverage some time to work with that? That's a starting point. That's a win. What are the new requirements and parameters from your school and community partnerships? We've heard from a variety of people that there's different guidelines around platforms. There's different guidelines about how much time you can have. There's different guidelines around capacity and resources. And if you used to be able to, partner with this teacher, maybe now you only have this much time with another teacher. So what's going on, and how can you get creative with those adaptations? One of the things that might be helpful to consider as you think about where you are with your school and community partnerships is consider creating sort of a matrix of options, so that if you know that you typically would teach maybe 8 sessions as an example, and that's your gold standard, start to think about, well, what are my options if I only have 4 sessions, or if I only have 2 sessions, or if I have 1 touch point over a semester or an 8-week time period? What could we do, or what would be the best thing to do? So start to just leverage what you do have and start thinking about where you can work with what you have versus what you can't do, if that makes sense. Okay, let's look at the next slide now. So the next type of partnership that we want to just engage in conversations with in a little bit are around health referral partnerships. And this is really important, as all of you know. This is a really important time to revisit and reconnect with those existing partners, referrals that you used to have in your community that maybe used to be a good fit, examining those current referral partners and networks and make sure that they still are a good fit. Do they still have the capacity to meet the needs of the youth and the community that you're serving? Are there additional priorities and needs, especially around mental health and emotional health and support services for youth and families, and maybe even your staff and your subcontractors and your subpartners? So what types of new needs have emerged, and what maybe new partners are out there? Again, not only mental health and emotional health support types of services, but thinking of ways to maybe even leverage APS topics to add new content. And it could be around cyberbullying, social media access, use, and safety as an example. But really, most importantly, is thinking about, are those partners still the right fit? Re-vet them, re-examine them. If they're not a good fit, it's time to find new partners. Maybe they don't have the capacity to do telehealth or something like that, or maybe they just don't have the capacity to meet the expanded needs within your community. Or maybe they weren't really providing high quality services and referrals prior to COVID. So this is a really good time to reimagine them, to re-leverage them, and to re-vet them, and making sure that they're meeting the needs and the priorities of your community. Okay, next slide. And finally, the third bucket of partnerships that is really important to take a look at, and we want you to engage in conversations, is with your own staff. So internally within your organization, and also thinking about any of your subcontractors or sub-awardees that you work with, any of the facilitators or people you're co-facilitating with, and really examine, again, setting realistic expectations given the current circumstances that you're all operating in, as well as the local conditions and sort of meeting the local needs of your community. So re-examining self-care and support, perhaps re-examining roles and responsibilities. Everybody, we never thought we would be in this for as long as we are, right? We thought we would shelter in place for a month. I'm reminded of the Dr. Seuss book, Oh, the Places We Will Go, and we never imagined that we would still be where we are right now. So be gentle with ourselves. Mistakes will be made. New things will be learned. It's okay. But as part of that, it's a great opportunity to really reassess, well, if I used to do this when I was going into the office prior to our conditions, is it still feasible? Do I still have the capacity to do my same role? Or alternatively, how many of us are taking on 5 other roles, right, that we never did before? And we don't get more time in the day, but we're stacking on more roles and responsibilities. So it's always good to stop and just pause for a moment and ask ourselves, is this realistic? How might we readjust them? How might we share resources or reestablish roles and responsibilities, and then, create realistic expectations around those. So some of the things might include, whereas we used to, even in an in-person environment, we might go out with 1 or 2 educators, facilitators. If you're implementing virtually, there's some good best practices coming out where there's at least two facilitators on a platform. But there are times as well, we're hearing from other grantees, that actually it might take more than 2. It takes a village, right? And so again, depending on the context and your community needs, you might need to reimagine and rethink those types of supports. It might be 2 people, it might be 5 people. So it's a good opportunity to just write down your roles and expectations, reestablish sort of your operating agreements, if you will, and move forward with those, and then readjust them as you need to. So next slide. So all this is to say, really, we're going to get to the meat and potatoes of this now, which is really all of you and engaging all of you in a conversation, because you are all the experts and we really want to facilitate this dialogue. So what we've presented is just food for thought and considerations. And I would like to offer just a simple process for sort of taking some of these considerations and now maybe putting it into action. And again, this is not the only way to approach this. This is just one way to take some of these considerations. So we've shared with you some points for consideration and potential conversations to have with existing or new partners. But now let's think about putting it into practice. So I like to think of a multi-step approach. So step one could be doing this environmental scan. And that might look different for everybody, but it's really understanding the larger context and the local conditions within your service sites. So again, looking at your school setting or your out of school setting, how are the teachers or the other adults engaging in youth? What are the new parameters? What are the new local conditions in your area? Across all the settings, understanding the local priorities, looking at the current resources. Do you need more resources? Do you have less resources? Do you have to add in new training? Where and how does your program fit into this new existing context? Instead of trying to force it to fit the way that it used to fit, it's reimagining and leveraging how it fits currently. So for example, if you're unable to implement your evidence-based program with 10 sessions as originally planned, and now you only have half of those sessions and half of the time, what other touch points and services can you provide? Step two might involve some other planning out after you've collected data. So use your data that you have, talk with your existing partners. Now you want to move into thinking about a planning stage. So what changes or adaptations do you need to think about making? What have you already made? What have you learned from those that you've already made? Are those still working? And are you documenting, and how are you documenting what you've been doing? Taking a good look at the resources and capacity of all your staff and all your partners. Again, really re-examining the roles and responsibilities and making sure that everybody who's doing what they were doing or what you're asking them to do now is still a good fit. Is it still a good fit? Is it the right fit? And then thinking about resources, again, those resources and capacity building opportunities for your staff and your partners. These are great opportunities to connect. There's going to be office hours coming up. There's going to be a virtual conference coming up. So remembering to continue to connect. And then coming up with an action plan and next steps. What's it going to take to make that happen? And then really kind of honing in on those additional steps to meet your local needs. So for example, re-vetting or re-looking at those partners, those referral processes, are they still good? Adding new partners as needed and letting go of those that no longer are a good fit. So next slide here. Let's take a moment really quick before we go into the breakout rooms, get us primed for starting to share examples with each other. So really quickly in the chat box, if you could share one or two things that you're either currently doing to engage creatively or reimagine your partners and partnerships. And I would add to this that if you're not doing anything currently, but you have a question, post that too, because that's also important. And I would also add, as we go into the breakout rooms and we're thinking about reimagining and re-examining our partnerships, an important piece of that with the local context is also applying a racial and social equity and trauma-informed lens. So as you're gonna be engaging and sharing with partners, if you have, if you can share with that or what you've done or questions you have around that, I think would be really also helpful for everybody in this space to move this conversation along.
Lisa, I see one, couple of folks are saying they've been using social media to engage with folks. They have been using slides and GIFs in Zoom calls and screens. Yeah, they created one, Michelle says she created postcards to send out to their contact list to encourage attendance at coalition meetings. That is terrific. Mm-hmm. The mail might be a little slow, but it is still working in the United States.
Yeah. Great. Okay, so in the interest of time, I think we need to go into our breakout rooms and get this conversation going.
Terrific. All right, there's one last comment from Rainey that says reaching out to help teachers to take some burden off during virtual learning. They've been more open to that now during COVID. Thank you for that.
Yeah.
Let's go ahead and go over some instructions, some brief instructions before we break out into our rooms here, and we are going to engage with Padlets. So there will be approximately 10 folks per room. Once you're in your room, go ahead and introduce yourself, and if you could identify someone who would be the facilitator who would like to share out some thoughts once we return all back into this main space together, that would be great. So you're going to go into your assigned room, and a person from RTI or ETR will provide you with a link to a Padlet specifically for your room. So room 1 will be connected with Padlet 1, for example. So, and in each room, you're going to be provided that specific link. Once you go in there, go ahead and open that link on your own computer. The ETR or RTI person in the room will be sharing their screen. And once you populate that screen, it will show up in real time. So again, you'll be opening that corresponding Padlet. So you will have 3 questions, and we would like you to begin a discussion about these 3 questions. So the school and community partnerships and health referral partnerships and internal partnerships. You'll have probably just under 10 minutes to discuss each of these buckets. And we'll be broadcasting to each room when it is time to move on, or if somebody is a good timekeeper, that would also be terrific in the room. So again, once you're in the room, you'll need to open that link on the Padlet to share. And the questions that we will be asking you to discuss today are, what are some of the challenges that you have experienced in maintaining or developing partnerships? What strategies have worked well? And then moving forward, how can you foster these how can you further foster partnerships in these 3 areas? So I have an example just right here in the chat, but all of your folks, you'll see a link similar to that one for your Padlet in each of the rooms. But let's go ahead and get started, and we will see you in about 25 or 30 minutes. Boy, that went quick. That felt like we were just getting warmed up. And so knowing that, we captured some really good challenges and some really good discussion about the different types of partnerships. Would anyone from room 1 like to share out an action that you learned or something that was shared in your room? And you can go ahead and write it in the chat, or you can go ahead and unmute yourself.
Narda, this is Derek. I was in breakout session 4, and
Great.
Before I have to jet off here in 5 minutes, I'll chime in, and hopefully this will serve as motivation for the rest of my team to chime in and give their responses. But we didn't frame it so much as an action, but there was a suggestion for a creative strategy to engage some of those health referral type partnerships and other partnerships. And that was hosting coalition meetings, which I guess some grantees do already, but bringing together as many external partners from across the spectrum as possible, be it juvenile, correctional, legal partners, behavioral health partners, foster care system type partners, etc. And sharing different ideas, needs, perspectives on the issue of adolescent pregnancy prevention, and sort of working in your agenda, if you would. You want to be responsive to all these different partners and what their agendas are, but while you have everyone together in one space, sort of working in your points strategically, and letting them know that you can sort of serve as a convener, and that this is an important charge that needs to be taken up, and you know, letting them know how important it is to have all of their voices at the table.
Wonderful. Thank you. That is a terrific suggestion. I know that we have just a few, we have about 3 minutes left, so I'll open it up to anyone from any of the rooms. Yeah, so convening partners, great suggestion. Other challenges or creative strategies that any folks came up with or thought that they could take some action from?
Well, this is, I know from room 6, and one of the challenges mentioned with school community partnerships was communication. And the strategy mentioned that I thought was very clever was proactive and overactive compensation. That you need to communicate proactively and more than you normally would, because you're not seeing these people in person. People are overwhelmed with other things, and you just have to sort of do it ahead of time and just keep at it. So I like that, proactive, overactive.
I like that too. I just wrote that down. Thank you. Anyone else? Rooms 1 or even our room 2?
I mentioned, I know I don't really have much time, but that our group talked a little bit about like, how do we make, like we talked about internal partnerships and how do we keep things fun and bring routines of joy as well, like pizza parties or Galentine's Day or the office holiday party, like not forgetting to do those points and only focusing on the work.
Right.
I like that. And one of ours, our last parting thought, which I loved in our room 2, was that their internal group is doing a lot of self-care, a lot of talk about taking care of yourself, taking time off when necessary, because you are doing a lot of work. One last takeaway from any of the groups that have not shared.
Yeah, I can go on for room 7. Some of the challenges were, just not being able to implement virtually, having a hard time interacting with students over a virtual platform. And so, there was mention of even creating like a Facebook page where teachers and students could interact with the facilitator, or even like a monthly newsletter to kind of keep contacts going, even if it's like asynchronously. Let's see. Yeah, using kind of GIF images, so maybe incorporating social media as well to kind of keep contact going, even if you're not able to see the students virtually.
Wow, Chloe, thank you. That is great. Just like creating a Facebook page and creating a space where people can come and gather. That's what I'm hearing a lot of. All right, well, so we are at the end of our time together. If you have any questions, please go ahead and reach out to your project officer. You can reach RTI at apptta@rti.org. We have a list of resources here as well that I believe will be shared with you. Just want to show you that there are a number of items here on the exchange.
Awesome. Thank you so much, Narda. I have a couple, or Lisa, did you want to say something? I have just a couple closing remarks.
Yeah, no, I put in the chat just so everyone knows that we're going to pull the Padlets together into one PDF to share out so that you can see all the great examples and ideas from all the breakout rooms. And thank you all so much.
Yeah, I just wanted to say thank you so much for joining us for day 2. We know it gets a little exhausting on these Zoom trainings. We hope you're able to connect with your colleagues and learn some new skills as you continue to navigate program implementation during this time. Another just announcement, we have extended the deadline for the PREP feedback survey and would love your input to help us guide new TNTA efforts over the next year to make sure they're really relevant for your needs. So I'll put that link in the chat. And then tomorrow afternoon, we're starting a tiny bit later. We're going to start at 1:30 tomorrow, Eastern time. So I'm sorry, I know that's a lot of different time zones, but 1:30 p.m. Eastern time with a grantee networking, and then we'll have our closing plenary. When you log in tomorrow, if you could please rename yourself to align with the name that you used during registration, that will help us to put you in the networking groups. It's that will be really helpful for us. So thank you so much. I hope you have a chance to rest and relax today or tonight or tomorrow, and we'll see you in a few hours.
Thanks, everybody. Bye.
Thank you.